2 years after the state legislature created a bulk purchasing trust fund to subsidize first responders' purchases of the overdose antidote naloxone, the fund has dried up. Now, some lawmakers want not only an infusion of cash for the program, but changes to who can buy the drug at a discounted price. I spoke with State Senator Eric Lesser about this and more.
So I was an enthusiastic supporter of Katie's amendment. We worked together on it. We also worked in concert with Andy Vargas, a really talented new state representative from Haverhill who worked on the House side to help get this funding up. The Narcan bulk purchasing program is really a success story. What it does is it pools purchases the same way Walmart does or Costco does or Home Depot. It allows the state to buy Narcan in bulk and then to pass those savings on to cities and towns. We were able to get the price of Narcan down from $66 a dose for a lot of cities and towns before the bulk purchasing was set up to $22 a dose. And what that means is exactly through this bulk purchasing program, cities and towns across Western Mass, including Springfield, where we sit right now, and Chicopee, just to our north, participate in this program. And actually, more than 90 cities and towns across the state have participated. And the important thing about this, Carrie, is if you bring the price down, that means you can get the Narcan into the hands of more people, which is really a life or death issue. Because if someone shows up and has the Narcan, they're going to live. If someone shows up and doesn't have the Narcan, they most likely will not.
Although, as your op-ed pointed out, with fentanyl now being on the market more and more frequently, sometimes Narcan, even 2 doses, isn't working here. So I've heard from a lot of people in the community who are frustrated, who say, you know, we're using this medicine to prolong the lives of people who might not even want it. What would you say to them?
So I appreciate that frustration, and I share, you know, that some of the sentiment behind it. Let me just back up for a second on that. I think we have a humanitarian emergency on our hands, which is we have 4 people, even 5 people a day dying in Massachusetts from opioid overdoses. And you're exactly right. The fentanyl is getting it stronger and stronger. Carfentanil now means that a Narcan dose is not working. You need to use 2, sometimes even 3 Narcan doses to save a life. I don't buy the argument that we should somehow let these people die because they made a decision that led to that overdose. I think we have a moral obligation to do everything we can to save those lives, but it doesn't stop there. I am certainly not someone who thinks we do Narcan and that's it. The Narcan is part of a broader strategy we need to have around, number 1, preventing these overdoses from occurring in the first place, and number 2, dramatically scaling up our treatment options, getting more medically assisted treatment into the hands of people, getting more beds, which is very, very important, and again, reorienting our criminal justice system away from a lock-em-up approach and towards a treatment and public health approach.
So you and Representative Vargas, as you mentioned, wrote an op-ed that recently ran in Mass Live, and among the things that you called for in the op-ed was, quote, not just a refill of the state's municipal naloxone bulk purchasing trust fund, but an expansion. How much has been spent by the fund so far? Because it's been replenished a couple of times, even though the money has been depleted.
Yeah, so it's been several $100,000 have been saved, but has been spent. But the important thing about this is...
So there was $150 to start, and then there was a bump from A.G. Healy's office.
Exactly. There was $150 in an initial legislative appropriation. There was also several $100,000 that was moved in from a settlement with the Attorney General's office with Amphastar, which was the maker of Narcan. And then the pharmaceutical company themselves contributed a portion. So it's been at this point several $100,000, approaching, I believe, $1 million. But the important statistic for people to appreciate is it's saving hundreds of thousands of dollars on the other end, because a lot of this Narcan has to be purchased. The police need it, the fire departments need it, our EMTs need it. They're going to either pay $66 a dose on the private retail market, or they're going to pay...
It's quite a bit. Since 2015, it was like $30 a dose or something
Exactly.
like
So
that.
this is another element, is you saw the price spike just as the need went up, as the crisis escalated. When Governor Patrick, this goes back several years now, declared a state of emergency around opioids, you actually saw the price go up, which is part of why the Attorney General sued, because this was really a price gouging situation. The bulk purchasing gives us one more tool to, number one, fight that price gouging, number two, bring that cost down, and number three, save taxpayer dollars in the process.
But to your point and Rep. Vargas's point about expansion of the program, are you saying you want to see more money put into the fund? And where's the ceiling on this?
Yeah, no, so we need more money in. These are relatively modest amounts. You know, the amount that was proposed by Katie O'Connor Ives' amendment last week was $150,000. So we're talking, these are very small amount. This is a very small amount of money for the overall, number one, the overall cost of the Massachusetts budget, and number two, the overall cost of this epidemic. Because let me tell you what's the most expensive is not having the Narcan on hand at all. I'll give you one example, Carrie. 2017, the statistics just came back. We saw an almost 10% decrease in the number of opioid-related deaths in Massachusetts. Now, you don't want to.
It's going down, but we've had Dr. Robert Roos and other experts.
But the
death rate is going down, but the addiction rate isn't.
The reason the death rate is going down is because of access to Narcan. Again, no one is saying Narcan is all we have to do. We need to do both. We need to save the lives of people who are currently experiencing overdose. Narcan has been proven to be the most effective way to do that. Dr. Roos worked with us on the bulk purchasing program you're referring to. The other thing we need to do, and it's abundantly clear and the evidence shows this, is we need to prevent the overdoses from happening in the first place, and we need treatment options in place. They have to happen in concurrence with each other.
And the other piece that you and Rep. Vargas were calling for is that you would want to see more agencies have access to this, nonprofits who are helping to treat addiction. Where did that concept come from? Are they reaching out to you saying, you know, we want this same right, or we want the same type of access?
Yeah, exactly. So the first version of this program was around municipal purchasers, so really police, fire departments, EMTs. But there are a lot of people that work with this population that encounter someone who might be experiencing an overdose who isn't a police officer or a fire department. For example, CHD, a organization that's been featured on WGBY many, many times, does a lot of work with recovery houses, with the recovery community. Their contractors, their human service workers would not technically qualify for this bulk purchasing program as it's currently written. So Rep. Vargas and I have legislation. The House adopted it in their budget last week. We hopefully will adopt it in the Senate very soon to expand the pool of purchasers to include not just cities and towns, but contracting agencies, human service agencies, groups like homeless shelters or home care services or rehabilitation centers that are experiencing a lot of contact with these populations as well.
We have a little bit of time left. I want to ask you about a couple of other Senate pieces of business that have happened recently. So we saw that recently the Senate moved to protect people who default on student loans and then they're stripped of their professional licensing. Where did that concept come from? And have you heard from people in this region who have defaulted and have lost those licenses, and what has it meant for them?
Yeah, great question, Carrie. Thanks for bringing it up. So this was actually brought up by a colleague of mine from Belmont, Will Brownsberger, who chairs our Judiciary Committee. It actually came from a big New York Times study that had been done about laws related to around this issue in a lot of different states. And it turned out Massachusetts was on the list of states. We don't have to get into the other states. It's not a group of states we necessarily want to be listed with that take away professional licenses if someone defaults on their loans. And it actually, the research showed it actually thankfully was not really being acted upon in Massachusetts. It was kind of a dormant law for good reason. It's a very bad law that was on the books that we can get into. So what we did is we kind of wiped that clean with this legislation. It really wasn't being enforced, and it shouldn't be enforced. Because if you think about it, it's very counterintuitive. If someone has a professional license, you know, let's say they're working as a mechanic. Exactly. Let's say someone's working as a licensed mechanic, they're having trouble paying their student loans. Why would you take away their only ability to earn the money back to actually pay the loan off, which is working, and working under the professional license that they earned? It was really a vestige of a previous time when we viewed these things in a very sort of strict and very draconian way. And I'm glad we got rid of it. And hopefully now we'll be able to build some momentum to get those laws repealed in other states. It does still need to go through the House, the Massachusetts House of Representatives, and the governor still does need to sign it.
Next steps on that one. We'll see where it goes. Senator Lester, thanks for coming in.
Thanks for having me.